So my name is Priya Kishnani. I don't have any slides. I joined the United States or came to the US in 1991 from India. I was a trained pediatrician, and I'm very grateful to my mentor, Dr. Y.T. Chen, for entrusting me and making me interested in the field of rare diseases. It's a very different mindset when you are trained in a country like India, where we're dealing with more common diseases, life-threatening in the form like malaria and tuberculosis. And then when you come to the setting of individualized rare disease aspects, I think it was an eye-opener. And I did my training in clinical and biochemical genetics at Duke. I was then fortunate to have a chance to build our program. So I've been there from ground up, and today I'm honored to have a division which is more than 85 members, and I just feel I'm standing on the podium representing the work of not just people, my collaborators and colleagues at Duke, but from physicians and scientists across the globe. I think the key message that I have here is that I have tried to apply one common theme, is listen very carefully to the patients, because I think our best learnings have come from the questions that you all have brought up to us. And I can say that that has really advanced our research at Duke, listening to what each one of you have brought up to us, ranging from questions like difficulties with bladder and bowel, to other aspects, anesthesia challenges, etc. And I think the approach that we've taken is more of a translational approach, not just the bench to the bedside, but very often taking the lessons from the bedside, that is each one of you, and taking it and translating it and learning from the bench and taking it back to the bedside. So once again, I'm honored and flattered to be here, and we are definitely all working together towards next generation and improvements in the care of our families and patients with Pompe disease. And I hope that today is an opportunity, actually today and tomorrow, for you to ask all of us the questions that you would like answered, because I think your questions sometimes are thought-provoking for each one of us in this setting at the back. So please do not hesitate to ask us that. And I can also say that each patient is an inspiration for us and has taught us, and each patient that we have lost has taught us how not to make that happen again. And another focus for me is to talk about taking this to the developing world. Having come from India, I definitely want to say not all our patients are as privileged. And Prasanna is here from India today. And I just want to give a shout out, because we have now an organization in India. I spend a lot of time there trying to advance the care of patients with rare diseases and trying to be available and answering questions throughout the world, not just for those of us here in the US and Europe and other parts where there's more affluence than others. Thank you so much.